Hi, and welcome back as we finish our exploration of the thigh muscles, and we're going to talk about thigh muscles anteriorly that are not your quadriceps muscles. So we've already learned 4 of them. So the first thing I want to talk about is something that is not an actual muscle, and this is a thick band of dense connective tissue, dense regular connective tissue that goes in a proximal distal direction on the lateral aspect of your thigh, and it's known as the iliotibial tract or the iliotibial band. Now, if you've ever worked out at a gym or talked with athletes, you may have heard about the IT band. That's what this is, okay? And like oftentimes they're doing rolling exercises because this gets very tight and hurts after working out. So the iliotibial tract is this band of dense connective tissue, just like a tendon is, and in fact, some of our muscles insert directly into it. So I want to point out 2 things before we move on. The first is, if you look at this laterally, you can see that the knee is off to your left, and you can see just above the knee that there are muscles clearly seen there. And I'm sure all of you would agree that that would be the vastus lateralis that you're seeing just anterior to it. Well, that's the vastus lateralis that you're seeing just posterior to it. So this iliotibial tract basically is kind of acting like a girdle holding in your entire vastus lateralis muscle. And if you continue going to the right, then the next muscle that you would be seeing there laterally, that would be your biceps femoris muscle. All right, the second thing I wanted to point out is go up to the buttocks area. And you clearly can see the gluteus maximus muscle, and the gluteus maximus muscle is going to insert into this iliotibial tract. I know it doesn't look like it matches up exactly, but in real life, if you look at the picture on the left, here's your gluteus maximus muscle, and then there's the tendon of it, and you can see how it inserts into the iliotibial tract. All right, now, there's one other muscle that's inserting into the iliotibial tract, and it's not a buttock muscle, it is an anterior muscle, and that's this muscle right here that I'm circling, and that's where we're going to start. That muscle, which is an anterior but extremely lateral muscle, is called the tensor fasciae lata. Kind of sounds like a drink from Starbucks, doesn't it? I want to point out some spelling, both of those second and third words, N in A-E-A-E. Now, there are times where in your textbook you may see an E-A-E, but that's because that's the plural form. So just make A-E and A-E. And the tensor fasciae lata is a great muscle that we use a lot when we are doing our leg abduction exercises. Okay, continuing on, where I am going to next is just a little bit medial to it. So there's the tensor fasciae lata, and then we're going to come medial. And what you have is you have a very nice thin slip of an S-shaped muscle. Proximally, it is lateral, and then it crosses the anterior thigh at an angle to insert on the medial aspect of the tibia. So this S-shaped muscle is called the sartorius muscle. And it's also known as the sewer's muscle, as in people who sew. Okay. And so to understand this muscle, it has 4 different actions. And you're going, oh my God, I have to learn 4 actions. I'm going, no. I'll tell you how you can remember them. I want you to sit cross-legged. Okay, so literally, pull your foot off the floor and sit cross-legged like you have to sit when you're sitting in the middle of your bed. All right. Now, look at your hip. What action is your hip doing? Is it flexing or extending? Same thing for your knee. Is it flexing or extending? Okay, so far you have hip flexion and knee flexion. That's the easy part. Now, if your hips were just flexed, they would be going exactly posterior, behind you, wouldn't they? Because if you stand up and flex your hip, it goes directly posterior. But it's not. When you're sitting cross-legged, it is coming back towards the midline. So it is rotating. Whoop. Yes, you are rotating laterally your hip, and you are abducting it at the same time. So you're taking it away from the midline, but then you are, whoops, I just realized you can't see it. If this is your thigh, you're taking your thigh away from the midline, but then you are rotating it. Okay, so those are the 4 actions. All right, moving on. All right, so we started up here laterally at the hip with the tensor fasciae lata. Then we just moved right next door to the sartorius, which ended here medially at the knee. We're going to stay with the medial tibial insertion, and we're going to go just proximal to this little slip of a muscle on the innermost aspect of your thigh. And that's a beautiful little slip, very graceful muscle known as the gracilis. And this is the first of the muscles that are going to be adducting, bringing our thighs back towards the midline. We have a whole bunch of adductors. Most of them have the word adductor as the first word of the muscle. This one does not. All right. So when you look at this anterior thigh, these are the quadriceps here. We're done with that. This laterally, that's the tensor fasciae lata. We're done with that. So let's stay in this triangle. So the triangle is made from the sartorius crossing at an oblique angle and the gracilis over here. Okay. So this is looking at it anterior head on, and this on the far right is looking at it from a medial aspect. And on both of those views, I think you can see this long muscle within that triangle too. Everybody see this long muscle within that triangle? Okay. So that long muscle within that triangle is called the adductor longus muscle. Guess what its action is? Yes, hip adduction. See, I told you this was going to be easy if they had the word adductor. All right, now let's continue. Let's look at the cadaver picture because I think it's easier seen there right now. On the cadaver picture, these were our triangles on both sides. Okay, so we had the big adductor longus muscle. And then if we move medial, there's going to be this muscle, and then there's going to be a tiny little muscle right there. Okay, so we're going to put 2 more muscles in this triangle up high. So here is a close-up of a different model where you can see it better. This is the sartorius. And with the white arrowhead, that is the gracilis. So we just did the long adductor longus. The very next muscle is a tiny little adductor muscle. So it's called the adductor brevis. Now, in the 2 pictures on the right, it looks very tiny. When you look at the cadaver picture, why does it look so big at this one? Because this purple picture has removed all the other muscles here. The adductor longus has been taken out. When the adductor longus is there, all you see is the tiny little piece. But as soon as you take away the adductor longus muscle, then you can see how big this muscle really is. Okay, but it's short. That's what the word brevis means. It means it's short. Doesn't mean it's tiny. It means it's short. Okay, see how much shorter it is versus the adductor longus muscle. All right, so now there's 1 more muscle right up here. Okay, so we have 1 more muscle that's going to be an adductor. And just like the first one, the gracilis did not have the word adductor, this one doesn't have the word adductor either, and it's called the pectineus muscle. So these muscles I've talked about. Gracilis is an adductor. Adductor longus, sorry, let me go to the middle picture so you can clearly see it. Gracilis was an adductor. Adductor longus was an adductor. Adductor brevis was an adductor, and pectineus is an adductor. Do you notice they are all on the medial aspect of the thigh? They're all going to be in the medial compartment of the thigh. Well, I meant on the medial aspect of the thigh, not not anterior, but the medial part of the anterior thigh. And so they are all going to have the same innervation and the same action. And in fact, they're all going to be inserting into the femur and the linea asperalis, and pretty much most of these are going to be coming from the pubis bone. I think you clearly can see them coming from the pubis bone, and then they're going to insert on the thigh, and that's how they're going to bring your legs together. All right. Here's a big muscle that we really need to talk about. And yes, it's an adductor. Krista has the word adductor in it. That's your first clue. But this is a super huge muscle. This is like the biggest muscle in your thigh. But in order to see it either anteriorly or posteriorly, you have to take off all the quadriceps or take off all the hamstrings. And so that doesn't happen in the model, but it clearly has happened in the cadaver picture, so you can see it. You see how huge this muscle is by comparison to the other muscles? And it's going to have this wide insertion here, which is going to be on the femur's linea aspera, just like all those other ones. But then it also has another little insertion down here. And so it has this little hole in it. All right. So this is called the adductor magnus muscle. If you were looking at it, it would have the width of your hand. Okay, it's huge. And so when we are trying to find it looking at the models, go back to the triangle we made with the gracilis and with the sartorius. And then we had right here, this was the adductor longus. Well, way down here at the corner point of that triangle, that was not adductor longus. That actually was part of the adductor magnus, which goes deep to the gracilis because the adductor magnus starts posterior to the gracilis and then works its way here. This bottom picture, what has happened is the sartorius right here has been removed. Okay. So there's your adductor long. Here's the medial aspect of your thigh because this is your gracilis. Okay. And there's your vastus medialis. And normally you would have your sartorius here, and then this would be your adductor longus in that triangle. So if you go down to where the corner point is right here, that would be right here. And when the sartorius is missing, you actually can see more of the muscle. And what you can now see and appreciate that you could not see before is what is happening to nerves and the blood vessels that you could see here on the anterior thigh. And what you see is they magically disappear. In other words, they're going posterior to a structure. If we had a blood vessel carrying arterial blood down the anterior thigh, and then when it crossed the knee, it stayed anterior, every time you would kneel down, you would block the blood flow to your leg and your foot. Not a good thing. If a nerve did the same thing, that would mean every time you knelt down, you would have no sensory input from your foot, nor would you have any motor to anything below your knee. So what has to happen is those anterior blood vessels have to dive and become posterior at the knee. And so that's what they are doing. They are diving behind the tendon right here, of the adductor magnus in that opening known as the adductor hiatus. So the dotted line is showing you that right there where they are, that space that we can't see because the model is solid, but we clearly can see in the cadaver, that is where the adductor hiatus is. So anytime you see a structure anterior disappearing, then you know that's the tendon, that's the adductor magnus muscle. Okay? And the same thing posteriorly, if you see them appearing in the mid-thigh area, then you know that's the tendon and that's the adductor magnus muscle that you're seeing a little blip of posteriorly as well. So that's it for anterior thigh muscles. I will be showing pictures showing that last thing later on when we come back and I do a review of the innervation of the lower extremity. So thank you. With this, we are done with all the thigh muscles, and I'll see you again when we start exploring leg muscles.